Chike, thank you for joining us.
Thank you so much, my brother. Good to see you again.
Good to see you too. I love the way. Let's not go there. So, Chike, this AI-powered platform to improve access to health for people living with disability. How does this work? Or how is it supposed to work?
AI is here. So technically what it simply means is you can see a doctor can see you at home. That's all.
As simple as that?
That's all. Technology has taken care of that.
Okay, so, and anybody can access it?
Anybody.
How easy is it to access? Is it as easy as having a device, any phone?
So long as your phone can do WhatsApp, that means you're data friendly, you're data enabled. You download the app, that's all. Okay,
so but let's look at it. People with living with disabilities.
People with disabilities. Because when you say we live with disabilities, you make disabilities a disease.
Okay.
But when we live with it, it is what it is.
So people with disabilities.
I became a person living with disabilities exactly 19 years ago today.
Okay, Chike, we'll come back to this conversation. We'll be back in a moment, Chike. Don't go away. And do stay with us. We'll be back in a moment. Welcome back. If you've just joined us, here's a recap of our top stories. Supreme Court of Nigeria affirms President's power to declare state of emergency, dismisses PDP's suit. Former Minister of Labour to remain in Kuje prison as court sets December 18 for bail ruling. And at least 37 killed as torrential rain triggers devastating floods in Moroccan town of Safi. Earlier, before we went on that break, we had in the studio Dr. Chike Okogwu, Chief Responsibility Officer, Center for Ability, Rehabilitation and Empowerment. We're talking about this new platform, AI-powered platform for access to health for people with disability. Chike, now, people with disability usually face physical, financial, communication barriers in the health system.
All three has been taken care of. That's the beautiful thing.
So you didn't even let me finish. Okay, how? Tell me how all three are taken care of.
My personal story. When this happened to me exactly 19 years ago, we were told I was receiving the best medical treatment in Nigeria available at that time. I don't want to mention the hospital's name. But for 2 weeks, they didn't know it was a spinal cord injury. And that's why I've been on this journey 19 years now. But today, if something like that happens, all you need to do is go on this platform. As soon as you tell the story about what is going on, even if the patient cannot speak and the family member can communicate with them, right there and then help comes. A neurosurgeon will come online and tell you what to do and match you with the closest MRI center to you in Nigeria. That's just for that. Take it a step further. A pregnant woman in labor needs to give birth. How does she communicate? But with this app, what it simply does is it has a space for virtual reality interpretation. So they call it virtual reality something like that. So what happens is she's able to use sign language to communicate with her through her device, and the device interprets, tells them what to do. So
sign language. Yes. So the device is all
because it's AI driven.
Okay, so but the other thing is spreading it across Nigeria, scaling it across Nigeria to areas that are technology deficient, for instance, that don't have access to technology, and then it costs. So real quick,
cost is about 2,000 naira a month, thereabouts, for you to be part of it. And the kudos to the speaker, Dr. Tajuddin Abbas, PhD. He made a commitment that about 20 million persons with disabilities will be signed on for free. They are working on it now, and they will even propose a bill that makes it mandatory for government to also take care of this. What this helps us do is that the National Health Insurance Scheme, which is a bit expensive for hospitals, the first line of intervention, which is you being able to tell the doctor what is wrong with you, because that it takes away the cost of you leaving home, the cost of transportation to the hospital, the cost of paying to see a doctor, Because for 2,000 naira, you get about 4 or 5 consultations in a month. So and even if you don't use it, you carry it forward. So what happens is you are able to see a doctor at home. If you now need further examination, maybe they need to come and take blood samples, or home carers are sent to you. So it makes life easy. It's not everything that requires you going to the hospital, but where you now need physical examination, even at home, and your phone and the camera, your carer can do the work of taking the doctor through what your physical examination is all about, and you get your response.
What you're saying here,
it's crazy, really.
Is a utopia.
Yes. We've been waiting for this. We're waiting for the day AI will help us deliver pregnant women at home. We'll get there one day.
All right. Yeah. Thank you so much. Dr. Chike Okogwu is the Chief Responsibility Officer, Center for Ability, Rehabilitation and Empowerment. Thank you for coming in.
Thank you so much.
We wish you well with this new platform and hope it goes.
I'm not the owner of the platform.
No. When I say I wish you.
It's Staff Africa and Koyo.
When I say I wish you, I mean I wish
all
everyone
of us
with
in the
disability,
community.
everyone in Nigeria, every Nigerian.
Yes, I needed to let you know that it's a collaboration between TAF Africa and Koyo.
Thank you so much.
Thank you so much.
Thank you. We wish you well.